Hello viewers, I am Dr. Vishal Sakle. I am consultant and intervention neurologist practicing Apollo Hospitals, Navi. Today I will give some information on migraine. Migraine is one of the common type of headache. In migraine, headache is recurrent and often severe and often associated with various neurological symptoms like nausea, vomiting, photophobia, phonophobia. Migraine attack is often unilateral. In migraine, pain is often unilateral, means localized to the one part of the head. Sometimes it can be bilateral. Sometimes it is localized to particular part of the head, like behind the eye, top of the head, base of the head. Sometimes it starts on the one part and spreads to other part, involving holocranial or whole head. Migraine pain is often severe. It is throbbing, pulsatile pain. Migraine attacks are episodic, means they occur one or two times a week or one or two times a month. But in chronic migraineurs, it can be daily attacks also. Before migraine, most of the people or they develop warning sign. We call it auras. Auras are mostly visual. Person describe it as a blurring of vision. We start in the one part of the eye and then it involves the whole field. Sometimes they describe it as a zigzag line, and after some time it is followed by the headache. Sometimes auras can be sensory, like they develop tingling sensation in the limbs. Some develop light sensitivity, noise sensitivity before the onset of the actual headache. Along with headache, there are a lot of other symptoms also, like nausea or vomiting tendency. Some develop actual vomiting also. They often develop intolerance to the loud noise. We call it phonophobia. Some develop intolerance to the loud, bright light. We call it photophobia. So photophobia, phonophobia, very common in migraineurs. Some develop dizziness or vertigo. Such type of symptoms are common in vestibular migraine or vertiginous migraine, which is also one of the common type of migraine. Then these type of symptoms, they are very, sometimes they are frequent and sometimes they are severe enough to impair day-to-day activity. So migraine attacks can be disabling in some people. There are certain triggers for the migraine. Migraine is not a disease, it is a condition. Your vessels are sensitive and in certain situations they get favorable atmosphere and environment and they get dilated and they cause various symptoms. Out of them, headache is one of the common symptoms. So there are certain triggers for the migraine. They can be different for certain different people. Common triggers are stress. Any form of stress, physical, emotional, will trigger migraine. Then change in routine. So migraine attacks are more common on the weekends or on the start of the week. Then exposure to bright light, now loud noise can be a trigger. Skipping your meal or fasting is often a common trigger in our population. In females, migraine is common during menstrual period. We call it menstrual migraine. It occurs due to the hormonal changes in the body. So different person can have different triggers. Certain foodstuffs also can be a trigger, like citrus fruit, then cheesy foods, then processed food, alcoholic beverages, especially wine, dark chocolates or pastries. These are the common triggers. So we have to identify the trigger in our so that we can avoid it and we can prevent it. Then there are other types of headaches also apart from migraine, like tension type of headache, then sinus type of headache. In tension type of headache, person will feel the constricting or pressure symptoms, but they will not have associated nausea, vomiting, light or noise sensitivity. In sinus related headache, person will often have history of allergy, running nose or sinusitis. There will be often seasonal variation, and in sinus headache, headache is localized to the part of the sinus involved. So these are the other common types of headache apart from the migraine we come across the day-to-day practice. Sometimes migraine is also associated with them. It can be coexistent. There are certain red flags, means certain alarming symptom along with headache where we should be cautious to rule out other secondary causes. What are these red flags? Then it's very severe pain out of proportion or changing character of the headache. Suppose you have, along with headache, you have other neurological deficits like you have weakness of the limb, double vision, fever. Then such type of headache needs evaluation to find underlying secondary cause. Headache in migraine, headache in elderly or new onset headache in any person needs some form of consultation to rule out underlying cause for the headache. Because there are certain entities which also cause migraine-like headache, but they need different treatment and sometimes prognosis can be different. Now, what is the treatment of the migraine? As I mentioned, migraine is not a disease, it is a condition. There are certain triggers, so we should avoid the triggers so that we can avoid lot of migraine attacks. So lifestyle modification is very important in migraine prevention. If you have light sensitivity, so you should use sun goggles, you reduce brightness or ambient lighting in your living room or in your workplace. Then you should not skip your food. Don't do fasting. Take your food regularly. Then maintain your routine schedule. Avoid strong smell, strong perfume. Inactivity is one of the known precipient of the migraine. So daily activity or aerobic active exercise are recommended in migraineurs. We generally recommend 30 minutes of walk or 30 minutes of any aerobic activity to prevent migraine. So it is often effective. Then comes the medicines. There are medicines to control and to prevent headache. So there are two types of treatment. One is to control the headache. When actually there is headache, we have some medicines. Simple analgesics are effective in migraineurs. Commonly used medicines are paracetamol, naproxen, combiflam to control the attack of the migraine. They are often effective if you take at the onset of the headache. Once you wait for headache to establish or medicine, then medicine will not be effective and you have to take repeat doses. And despite taking medicine, the headache duration can be long. So don't wait for headache to establish. Take at the onset so that simple analgesic in simple minimal dose will be effective. Sometimes analgesic may not work in certain people. Then we can need a repeat dose of the analgesic. Sometimes triptans or different type of medicines they are used to control headache. Nowadays we have various triptans available in different formulations like oral disinfectant form, then nasal sprays, so that onset is effective. But sometimes, despite all these measures, headache can last longer, and headache is often severe, associated with vomiting. Then such patients often need hospitalization for injectable agents. Then, if headache is quite frequent, then we generally give medicine to prevent it. There are a lot of good medicines for it. Generally, we give them for few weeks, sometimes few months. And once headache frequency is low, we taper off and stop them. Commonly used medicines like amitriptyline, then beta blockers, certain anti-epileptic, then calcium channel blockers. They are commonly used to control migraine as a preventable agent. So migraine is not only treatable but also preventable condition. Migraine attacks are often disabling and they cause workday loss. So don't ignore the symptom of migraine, and if you have any such headache or common symptoms suggestive of migraine, please consult your neurologist. Thank you.